Hello and welcome to It's Your Business with Mario Toneguzzi on Megapix Media. Joining me today is Paula Allen, who is Senior Vice President of Research, Analytics, and Innovation for Morneau Shepell. Sorry. Thanks for joining us today, Paula.
It's a pleasure.
Okay, so you folks put out your monthly health index. Tell me just first of all what you saw as some of the key overall findings of this month's health index.
Well, there are several. I think overall, it's important for us to understand that since 2020, since this COVID-19 pandemic, the mental health of Canadians has declined significantly. So we're not just talking about a little bit of anxiety, we're talking about increases in anxiety, depression, decreases in optimism, quite a significant drop. And even 6 months in, we really haven't seen that much improvement. So it really has put our entire population at a state of risk. Now, one of the most interesting things is that there are some groups and some people who are experiencing more risk and more compromise than others. So we've seen females, we've seen younger Canadians, we've also seen parents. So with the anxiety that we're all feeling, with the change that we're all feeling, the other level of responsibility for another human being and what they might be feeling has really put parents at higher risk. Another group is the group of many, one of many of us who have had our salaries reduced. So we've maintained our employment, and our organizations, that in order to maintain our employment, has reduced the salaries of major pockets or the entire organization. And what we found is that those individuals, they actually have lower mental health scores than people who even lost their jobs. So that was a bit of a surprise. But when you think about it, with all the uncertainty that brings, it certainly isn't completely unexpected. But again, it wasn't obvious to us at the very beginning that this would be the case.
So, when, there's no end to this anytime soon, it appears. So from a mental health perspective, I guess this is going to be a long-lasting thing for Canadians, is it not?
Yeah, without question. I think there's a couple of things. So even if we had a real clear light at the end of the tunnel, even if things went back to exactly the way they were, the experience that we have all had is potentially going to last with us for a while. Not everyone, people are going to get through. Some people would go get through quite well. But when you have something as significant, when you have this much uncertainty in your life, when you have this much change in a short period of time, it often changes our outlook. It often changes our personality. It is that tipping point for risk. So in one situation, even in the best of outcomes, we have to pay attention to that risk so we go down a positive path and this doesn't cause lasting damage in our lives. The reality of this pandemic is that as you said, it isn't going to end anytime soon. We're into a second wave. We might go into a third wave. It might be with us for quite some time and we just have to manage it. One thing that is clear is that the level of uncertainty has not gone down one iota. And that uncertainty and that long-term uncertainty increases our level of risk. So I'm so pleased that you're talking about this, because we cannot just say, well, of course our mental health is impacted. This is a crazy situation.
Yeah.
We have to do something about it, because it really is a huge risk for us all.
Let's talk a little bit about the workplace. What has been the impact on people's mental health of all those changes that have been taking place in the workplace these days?
Yeah. Well, so as part of our mental health index, we also measure work productivity. And the way that we measure it is really how much effort does 1 hour of work take? How much, concentration are you able to expend? How much productivity? Because people are working longer hours, which kind of masks a productivity compromise, but we've seen productivity impacted, across the board in the way that we measure it. Um, what we found in September is that almost 4 in 10 of us are actually, our motivation at work is actually decreased. So compared to 2019. And that motivation decrease is a symptom of everything that we've been experiencing, that emotional drain, that fatigue, but also a lot of things have been knocked off balance. We're not, many of us, structuring our lives to get the kind of fun and social support and, blowing off steam in a healthy way that we were before. So that's another factor in the motivation.
One of the things that I found interesting from your research is people are less willing right now to access care. Why is that?
So another one of the many tentacles when things are not the way they optimally could be in terms of your mental health. When we are feeling compromised, very often we don't have the energy to do the things that we should be doing. And we all know that we should take care of our mental health and seek support. We all know that we should take our care of our physical health and seek professional support as well. But that willingness, that energy is one of the symptoms, one of the compromises of that huge decline in mental health. So, yet another impact. We have our quality of life and our health, our personal health. We have our work productivity impacted, but we also have long-term risks in terms of our overall health, including our physical health, because we are not as willing to seek the care that we need. And I don't need to explain to you that that will have serious consequences.
Yeah. Okay. Well, great. Thanks for joining us today, Paula.
It's a pleasure.
That was Paula Allen, who is Senior Vice President of Research, Analytics, and Innovation for Morneau Shepell. This has been It's Your Business with Mario Toneguzzi on Megapix Media. Thanks for joining us today.